بسم الله والحمد لله والصلاة والسلام على رسول الله وعلى آله وأصحابه ومن تبعهم بإحسان إلى يوم الدين وبعد. يا أيها الذين آمنوا اتقوا الله حق تقاته ولا تموتن إلا وأنتم مسلمون. My dear respected brothers and sisters in Islam, if you remember last week's sermon, we talked about the pandemic and how it has brought our attention to death, disease, and medical attention. This week I want to talk to you about how it is also bringing our attention, if we allow it to a number of injustices and racial disparities that currently define the framework of this country. To begin, we look back to the CDC, directly related to the coronavirus. The CDC, Center for Disease Control, reports demographic information like race and ethnicity as it pertains to cases, hospitalizations, and deaths. And in comparison to whites, Black Americans have 1.4 times more cases, 3.7 times more hospitalizations, and 2.8 times more deaths from the coronavirus. The CDC states that race and ethnicity are risk markers for other underlying conditions that affect health, including socioeconomic status, access to health care, and exposure to the virus related to occupation, like being a frontline worker, noted as essential or critical to infrastructure. What does that mean exactly? How is there racial disparity and injustice going on here? I mean, you can see there's a huge difference in caseload, hospitalization, and even, unfortunately, the death rate between white Americans and blacks. To spell that out, a professor of social epidemiology, Nancy Krieger, at Harvard School of Public Health, listed a variety of factors that put people of color at greater risk from the virus. This was published by Harvard Medical School, and also a much longer interview that was conducted and is available online in the New Yorker. And this was, we could say recent. This was last year in April. So the numbers have solidified since then. However, she goes on and says that they're more likely to live in crowded conditions, to work in service jobs that put them in close proximity to others, and have to go to work because they can't afford to miss it, even when they're feeling ill. Many of us have the luxury of staying home when we feel sick, and that is one of the biggest things that was promoted and is promoted. If you feel sick, stay home. But there are some people that just cannot afford to even take a single day off from work. They often have to take public transportation and lack access to protective gear while at work. They are also more likely to have pre-existing health conditions that increase the risk from COVID-19 and to lack access to health care and health insurance. And they live in areas with high levels of air pollution. This has to do with environmental justice, how communities of color are often more exposed to toxins. And that's how we've designed residential areas and located factories and pollutants, etc. And it's often the black community that ends up in those residential areas, and so they're overexposed more than the white community. And according to these types of exposures to high levels of air pollution, etc. The Harvard School study has linked these two together, meaning pollution, exposure to it, and risk of death from the coronavirus. And now, as the vaccine starts to roll out, initial data is showing racial disparities and how that is happening as well. Communities of color simply do not have the access that many white communities have. These are just some of the issues of inequality directly related to healthcare and COVID-19. Public health, the healthcare system, access to it. And there are many other issues of inequality and injustice that have been not only more and further exposed, but exacerbated because of the coronavirus. I want to mention one more issue that weighs heavy on my mind. If you remember, January of 2019, I know this is a task, to try and remember what we talked about like 2 years ago. I delivered a sermon I entitled it Happy Murder Year. Maybe you remember that, maybe you don't. If you don't remember, in it we highlighted the shocking homicide rate in Philadelphia. I highlighted the fact that there were 351 people murdered right over there, across the bridge in the heart of Eagle Country. We identify as like the suburbs of Philadelphia, and we root for the team. In 2019, there was not much difference in that number. 356, that was an increase of 5 people were murdered in the city. And I'm not trying to downplay that number. That's a huge number, by the way. For a city, a large city, 350-some people being killed, murdered, not dying of natural death or even from the pandemic, but they were murdered, and a lot of it had to do with gun violence. It's a huge number. It's at the top in the country. But you know, in 2020, that number increased 40%. And that type of increase was a trend around the major cities of the United States, such as New York, Chicago, and LA. According to the police department database, there were 499 homicides in the city of brotherly love, Philadelphia. With Black residents overwhelmingly the victims. Black Philadelphians, according to police data, accounted for about 86% of those 499 homicides. Shooting victims were disproportionately Black as well. Black Philadelphians were the victims of 84% of 2,236 shootings in the city, according to police data. You know, the community activists in the city, they say that there are a number of underlying causes, and that's what we have to understand. On the surface, we go, well, look, people are violent and they have guns and there's this and that and the other, but there are underlying causes that set the stage for such activity. The community activists, they say poverty, a lack of access to economic opportunity, access to firearms, confrontations, and institutional racism continue to drive the homicide rate in that city. But now, as of 2020, there are other community leaders that believe that the coronavirus has exacerbated the situation and increased that number, as you might imagine. One of the community leaders noted that the pandemic closed school buildings, moved learning online, nixed sporting events, gyms, and other activities, and prevented the community leaders from engaging with young people. Basically, the avenues to pull people out of those environments, they were shut with no alternatives. And it also prevented police work. By their own admission, the police department said that the virus thwarted their efforts to prevent such violent activity and some of the investigations of the cases. And their case investigation success rate is very low. In previous years, it's just above 50%, and now it's around the 40s. Brothers and sisters, what we're seeing, the impact of this and uncovering and highlighting some of the injustices, it's a true tragedy. It's where people's ability to live a life free of harm is being systematically hindered because of race and economic status. أقول قولي هذا وأستغفر الله لي ولكم ولسائر المسلمين من كل ذنب فاستغفروه إنه هو الغفور الرحيم. بسم الله والحمد لله حمدا كثيرا طيبا مباركا فيه كما يحب ربنا ويرضاه نصلي ونسلم على نبينا محمد وعلى آله وأصحابه ومن تبعهم بإحسان إلى يوم الدين. يا أيها الذين آمنوا اتقوا الله وقولوا قولا سديدا يصلح لكم أعمالكم ويغفر لكم ذنوبكم ومن يطع الله ورسوله فقد فاز فوزا عظيما. You might be asking yourself, why am I even mentioning this? We're not residents, most of us at least aren't residents of Philadelphia. We may not be experiencing those things when it comes to health care. We may be, I don't know. The reason that I'm mentioning this is because Allah subhanahu wa ta'ala says, يَا أَيُّهَا الَّذِينَ آمَنُوا كُونُوا قَوَّامِينَ بِالْقِسْطِ شُهَدَاءَ لِلَّهِ وَلَوْ عَلَى أَنفُسِكُمْ أَوْ الْوَالِدَيْنِ وَالْأَقْرَبِينَ. It says, "O you who believe, uphold justice and bear witness to God, even if it is against yourselves, your parents, or your close relatives." Allah subhanahu wa ta'ala has called us to be just. He's instructed us, the mighty and the divine, to be fair. In our own worlds, in our own lives, our own surroundings, we need to be very, very careful that we do not drift into the murky waters of injustice that run through this system here. Though it may seem like swimming upstream at times, we need to rely on our faith to provide the guidance we need to steer and navigate a true and righteous course. You can never underestimate the influence of your surroundings. Never underestimate the power of influence. It can shape your thoughts, mold your attitudes, and inspire actions without you even detecting it. That systemic racism and injustice may be we could say an integral part or the underpinnings of this system. We could be easily influenced and start to adopt the same type of thinking and attitude towards other people because the color of their skin or their economic status, when in fact, as Muslims, we should be the exact opposite. That was not the guidance of our Prophet, alayhi salatu wasalam. We also have to find the strength in our faith to rise up against injustices in our own world. Allah subhanahu wa ta'ala says, "Kuntum khayra ummatin ukhrijat lin-nas, ta'muruna bil-ma'ruf wa tanhawna 'anil munkar wa tu'minuna billah." You're the best community ever raised for humanity. You encourage the good and you forbid the evil. You believe in Allah. And injustice is munkar. Racism, prejudice is munkar. It's evil. And as people of faith, it's one of our duties to stand up and fight against that. I think it's extremely important that we get through the pandemic not only healthy, but better people. As better people, taking the opportunity as it comes to us, whether we like how it's presented or not. The pandemic not only has it reminded us the value of life and of health, but it's also highlighting to us the value of fairness and justice as we see some people, many people, being treated otherwise. Don't overwhelm yourselves looking at this burden on a national or global level. I know sometimes it may seem like, well, what can I do as an individual? This problem is systemic in nature. It's widespread. Who am I to do anything? Rather, you need to ask yourselves what you are able to control, what you are able to impact. Two things. What can I control, and what can I impact? And for many of us, that means that we need to be looking locally. Local opportunities to influence and make positive changes. And I will make it very easy. In case you're not plugged into that, I'll make it very easy. The Cherry Hill Free Clinic is a great example of that, talking about healthcare and access to healthcare. The Cherry Hill Free Clinic is an excellent example of that. That was a community project that started right here. Perhaps you were a part of that when it was launched and can still be a part of that or join that cause today. Talking about the great work that they're doing over there. Even during the pandemic, they're still in operations. And they are making amazing strides to be able to relieve some of the burden when it comes to the impact of the coronavirus as well as vaccinations. The clinic has been working hard to serve some of the most vulnerable of our community, the local community, and that's the type of impact that we can have to help deliver justice and fairness on a local level. They're always in need of support. You can check them out, cherryhillfreeclinic.org. cherryhillfreeclinic.org, whether you want to volunteer some of your time or donate some of your wealth. You can also look at what's happening here at GCLEA, your place, your masjid. I've mentioned this before, that we've launched an initiative called Muslims for Justice, and in the last several months, 6 to 8 months, I would say, we've been curating content, providing content on our website to help increase awareness of some of the social justice issues that are front and center of our communities today, and have begun providing extremely easy ways to get involved. On a local level, whether it be grassroots or whether it be legislative in nature. You can look at that on our website, gclea.org/Muslims for Justice. If you don't look there, you have to look somewhere. You have to get in where you can fit in, because it is a moral duty for us as people of faith. And having been on the other side, I know that we have a great deal to offer to our communities outside the walls of our masajid. And in the meantime, we ask that Allah subhanahu wa ta'ala keep us healthy and safe, that He restore the rights of the oppressed, and that He give us the strength needed to act as His agents of justice on this earth. وصلى الله وسلم على نبينا محمد وآخر دعوانا الحمد لله رب العالمين وأقم